my name is Sylvia Azania, and in this video, we will discuss the changes that can occur in the levels of amniotic fluid. We will clarify why amniotic fluid is significant during pregnancy. We will explore how to measure the volume of amniotic fluid and what occurs when there is an excess or deficiency of it. Additionally, we will answer the most frequently asked questions that users may have regarding this topic. Amniotic fluid is the yellowish substance that is found inside the amniotic sac, and it is the liquid in which the baby floats while inside the uterus during the pregnancy. One of the important roles of amniotic fluid is to safeguard and protect the baby by absorbing the mother's movements. Nevertheless, the amniotic fluid also helps maintain a constant temperature, and it further allows the baby to move freely around inside the womb for proper bone and muscle development. Additionally, amniotic fluid plays a very important role in the proper development of the baby's lungs. Amniotic fluid is constantly renewed throughout the pregnancy. The baby inhales it, but also produces urine that becomes a significant part of the amniotic fluid. As a result, any significant changes in the amount of amniotic fluid may signal a maternal or fetal issue, potentially leading to severe complications during pregnancy. The quantity of amniotic fluid is evaluated via ultrasound employing one of these two techniques, maximum vertical column. The maximum vertical column of the amniotic fluid is assessed and quantified. Normal values are considered to be between 2 and 8 to 10 centimeters depending on gestational age. For the calculation of the amniotic fluid index, the uterus is split into 4 quadrants, and the maximum vertical columns from each quadrant are added together, with a normal liver size ranging from 5 to 24 centimeters. Typically, the standard and most commonly used method for evaluating the volume of amniotic fluid in low-risk pregnancies is by measuring the maximum vertical column. However, if any anomaly is detected during the pregnancy, the specialist proceeds to calculate the liver size. The condition in which the amniotic sac contains an excessive amount of amniotic fluid is called polyhydramnios. This condition is found in roughly 1 to 2% of pregnancies. Polyhydramnios is usually mild. Nonetheless, if it is serious or if it occurs early during pregnancy, the risk of experiencing complications increases significantly. The main causes of increased amniotic fluid can, in many cases, be related to both the mother and the baby, and these causes may include the following: gestational diabetes, multiple pregnancy, anemia in the baby, such as the type that is caused by Rh incompatibility problems, gastrointestinal disorders or abnormalities of the urinary system or the nervous system of the baby, as well as fetal infections. Nevertheless, the causes remain unknown in approximately half of all cases of polyhydramnios. Although polyhydramnios can sometimes show no symptoms at all, women might experience issues like difficulty in breathing or a persistent feeling of breathlessness, particularly in cases of severe polyhydramnios. This is because the uterus is enlarged, which puts pressure on the diaphragm and other organs of the mother. Additionally, the woman may also begin to experience painful uterine contractions and swelling in her legs. Although the specialist may suspect polyhydramnios in situations where the uterus appears to be larger than expected for the stage of pregnancy, the diagnosis is made by calculating the amniotic fluid index, which must be greater than or equal to 25. After the diagnosis of polyhydramnios is confirmed, the specialist will proceed to conduct a series of tests on the woman in order to investigate the causes of the condition, like tests to exclude conditions such as gestational diabetes or maternal isoimmunization. Additionally, the specialist will want to monitor the progression of polyhydramnios, so the pregnant woman will attend regular checkups. As for treating this excess amniotic fluid, it will depend on several factors as the known cause, if there is one, the actual volume of amniotic fluid present, and the stage of pregnancy the woman is currently in. Therefore, if the cause of polyhydramnios has been identified, appropriate treatment will be administered. In certain situations, amniodrainage may be proposed, particularly if the polyhydramnios is severe or if the mother has serious symptoms. This medical intervention consists of aspirating the amniotic fluid in order to reduce its overall volume. On the other hand, it is possible to use certain medications to reduce the amount of urine produced by the baby and therefore the volume of amniotic fluid. Nonetheless, these medications are occasionally used because of the potential negative effects they can have on the baby. In conclusion, the specialist will evaluate the best moment for the birth. Oligohydramnios is the medical term used to describe a condition where the amniotic sac contains a reduced volume of amniotic fluid, an amount that is less than what is considered normal for the gestational age. The consequences of oligohydramnios, which refers to low amniotic fluid, will vary depending on the cause, the level of severity, and the particular stage of pregnancy in which it occurs. The leading factors contributing to the decline of amniotic fluid during pregnancy might include abnormalities in the fetal urinary system or other fetal abnormalities, restriction of intrauterine growth, cytomegalovirus infection of the fetus, prolonged pregnancy, post-term pregnancy, early membrane rupture, challenges and irregularities found in the placenta, high blood pressure, and certain medications such as ibuprofen. Despite this, the causes of oligohydramnios can sometimes remain unknown. Oligohydramnios is usually asymptomatic, and the woman will not notice any symptoms. Occasionally, a woman might feel fetal movements that are not as active or are fewer than expected. In contrast, if premature rupture of membranes has occurred, the woman will experience a loss of amniotic fluid. It is true that oligohydramnios may be suspected when the uterus is smaller than expected for the gestational age. Nonetheless, the process of diagnosing oligohydramnios involves measuring the amniotic fluid index through ultrasound. The diagnosis is made when the measurement is less than 5 centimeters, which leads the specialist to request a series of tests from the pregnant woman to try to determine the causes. Following the diagnosis of oligohydramnios, regular ultrasound examinations will be scheduled to closely monitor both the baby's growth and the amniotic fluid index, along with additional tests to evaluate the baby's heart rate. However, it will be important to address and manage the cause that is producing it if it is known. Additionally, it may be recommended that the pregnant woman rest and increase her fluid intake. On the other hand, the specialist will also assess the best time for delivery based on the specific situation. Now we will provide answers to some of the most frequently asked questions users may have regarding this topic. What should pregnant women with oligohydramnios do? Oligohydramnios is the decrease in the volume of amniotic fluid compared to what would be considered adequate. The causes can vary and may be related to the fetus, the mother, or, for example, complications such as premature rupture of membranes. Therefore, depending on factors such as the underlying cause, its severity, and the stage of woman's pregnancy, the indications may vary. The most advisable course of action is for the woman to follow the recommendations given by the specialist overseeing her pregnancy. What effects might occur if there is an excess of amniotic fluid? When there is an excess of amniotic fluid present during pregnancy, a condition known as polyhydramnios, certain complications may arise, such as respiratory problems in the mother, premature rupture of the membranes, placental abruption, premature birth, cesarean delivery, and umbilical cord prolapse. For this reason, in the case of a diagnosis of polyhydramnios, the specialist will conduct a thorough examination of the pregnancy. We are very eager to learn about your experience, so please feel free to share it in the comments section. If you enjoyed this video, please give it a like and subscribe so you don't miss any future videos. Also, I want to remind you that there's a link in the description to an article where you can read a lot more. Thanks.